enter the room.
Hello, I'm Dr. Gunratna, one of the foundation year doctors in GP surgery. Are you Jaden Albers?
Yes, doctor. My name is Jaden.
Okay, Jaden, how would you like to call you?
Jaden's fine.
Okay, could you please confirm your date of birth?
Yeah, I'm 50 years old.
Okay, from my nice to meet you, Jaden. From my note, I can see that you have come in for the venous ulcer for about 2 months period, which is there for 2 months period, and you have been on compression stockings. So, how have been so far?
Um, it's been very uncomfortable, doctor. I don't want to wear them anymore.
Okay, so Jaden, I would like to ask few more questions regarding your background, medical health, and how this is happened at first place to get a better picture. Could you please tell me more about what exactly happened when you were diagnosed with this condition?
Well, initially this happened like about 2 months back, and I had these, I had these veins that were popping, and there was like a wound that came after that. So the doctors told me that it was related to the veins, and so they gave me the compression stockings to wear, and I have been doing that since.
Okay, so did the doctor do any investigations like scans?
Yeah, when they actually mentioned something about the veins, they did some scan. Yeah.
Oh, okay. So how about the treatment? Are you uh, do the compression stockings as they prescribe?
What does that mean,
Are,
doctor?
are you apply it regularly?
Yeah, I do. I'm following all the instructions they mentioned.
Okay, then you mentioned about it is a bit uncomfortable. Is it too tight for you?
Yes, it is. In fact, I mean, sometimes I have, this itching around my wound, and it kind of gets worse when I'm wearing the stockings.
Okay, how about your wound? Is it oozing or it has any pus discharge?
Yeah, there's this yellowish, watery discharge that comes from time to time.
Okay, any ongoing fever?
No, doctor.
Any calf pain?
No, doctor.
Okay, so you mentioned that it's a bit uncomfortable and there's a worsening of the oozing as well. So, are you ever diagnosed with any other medical conditions?
No, doctor.
Any allergies?
No, doctor.
Any regular medications?
No, doctor.
Okay, so do you, what do you do for your living?
Um, well, I'm retired at the moment.
Okay, so who do you live with?
I live with my wife. She's very
Okay,
supportive.
so do you smoke?
No, doctor, I don't.
Oh, okay, do you take alcohol?
Occasionally, from time to time.
Okay, how this symptom affect your life?
Well, yeah, it's been very irritating, I mean, the wound itself is not that painful, but it's very it's very uncomfortable.
Okay, I'm really sorry about that, Jaden. Do you have any idea or any particular concerns other than this discomfort feeling with the wound and the oozing that I should discuss here?
Yeah, I was hoping if you can, refer me to someone so that I can get a different treatment for this. I don't like the stock
Oh,
inside.
okay. Thank you very much, Jaden, for sharing all the information. I would like to examine your uh, general physical examination, heart rate, blood pressure, temperature, and respiratory rate, and also would like to measure ankle brachial pressure index and assess your wound, the wound and the lower limb, and also the pulses. From my assessment, I can see that your ankle brachial pressure index is 1, and it is not actually bad, and which is we usually considered less than zero point 0.8 is a bit concerning. In your case, it is 1, and also I can see some changes in your lower leg, which is compatible with your venous disease. And do you have any idea what is regarding your diagnosis?
Well, I know it's because of the veins. Yeah. What
Yeah,
about it?
yeah, it's actually the veins. Veins has its own valves. The valves incompetency can lead to this venous falling, and because of that, these skin changes and these ulcers can happen. And this blood clotting also affect the wound healing as well. In your case, I can see that you have been wearing this for 2 months' time, and it is really bit tight for you, so I can change your compression stockings to the right size, so that would be easy. And in the same time, I would like to refer you routinely to the vascular surgeon, so they will assess the lower leg vascularity and decide on further management. Do you like to know what they're going to do?
2 minutes remaining.
Yeah, sure. Yeah.
Yeah.
Yeah, that would be great.
Yeah, they will do a venous Doppler scan to assess the blood flow of the lower leg, and depending on that, they will decide on whether to go ahead with the surgery. There are several methods like sclerotherapy, and it means some medication will be inject to the dilated vessels, and also some laser treatments are also available. It depends on the risk versus benefits, and it is a consultant decision. And apart from that, for the wound healing, I would like to refer you to the tissue viability nurse. So they will care about the wound care, and they will provide relevant information that you need to get yourself improved from the wound and make sure it not get infected. So I will provide you the leaflet as well, which include the regarding venous ulcers, as well as the methods, treatment methods for the vessel disease, like the varicose vessels disease. So you can read on that. If any concerns, you can always come back and ask about that. Anything else do you especially want me to consider?
Yeah, I mean, I guess that covers it. I was hoping, you could, change the stockings maybe. It's very uncomfortable to wear them.
Yeah, as I mentioned, I will change it to the right size, so you can wear it until the your referral is called. If you didn't, it is a routine referral, so it takes some times. So if at any point you develop any ongoing fever, any wound change or worsening, and you have any calf pain, please do come to the A&E. How that sounds to you?
Move on to the next station.
All right, doctor, good job. So the second time over, you actually confirmed, the identifiers, acknowledged the frustration, elaborated the presenting complaint. That's also important, like at this point, what are the symptoms that you're facing from the wound? How is it currently? Has it increased from before? Has it, stayed the same? Because you actually want to see how much of the stockings has been effective. That's what you can bring back in your management as well, right? Ask about changes in symptoms like increase in pain, discharge, odor, swelling, detected complications. Yes, good job on that. Assess compliance to the stockings. Yeah. Inquire about previous ulcer or chronic venous discharge, diabetes. So you just want to see, are there any other, factors that could be, what to say, impeding the healing process, right? Maybe this patient might be having diabetes that's causing, the delayed healing. So, you might want to check his, how much of his diabetes is under control, and want to send him for a review for that, right? So any other, cofactors that could be impeding this healing process as such. Ask about the current medication, known allergies, identify any factors impeding the healing or contraindications, explore family history. Ask about lifestyle like smoking, alcohol use, prolonged standing. I'm going to give you a partial for this because I think you asked about the smoking and alcohol, but the main problem that you need to identify is, is there any risk factors that is increasing this venous insufficiency, which is worsening it from improving, right? Any lifestyle factors itself, like the prolonged standing. Is he actually, exercising, like I mentioned about the peripheral heart, the gastrocnemius and soleus, actually, standing on your tiptoes is actually a very good advice that you can actually give them, because, the soleus actually compresses, the vessels gets contracted, and that way it can actually improve the blood flow. Right, so those are a couple of tips you can actually tell them, and even improving their diet so that the healing is better. Assess the impact of the ulcer on daily activities and the quality of life, including work, mobility, and sleep. I'm going to give you a partial for that one as well. Right. Explain the current diagnosis of a non-healing venous ulcer and clarify why healing is delayed despite compression. Did you do that? I'm not really entirely sure. Were you able to actually tell him, why exactly the healing is being, delayed?
Not very clearly.
Yeah, so that's the issue that he's come with, right? Like, this was supposed to be my treatment, and yet you did not, and yet it's not actually working. So you can actually give him suggestions that maybe it's not the right kind of stockings. Maybe there might be some activities that you're doing that could be impeding the, the healing process itself. So give him some supportive treatment, like some lifestyle advice that you can actually say that would be easy to implement, right? Medical management, right? And any supportive management, like if there is any pain, you can actually address that, right? So always when you're thinking of management, think about the presenting complaint. Now, within the presenting complaint, what can you do? So the presenting complaint was the uncomfortable stockings. So what you're going to do about that is change the stockings, right? Give it a lowest, grade itself. And what are the other issues that you have identified? That he was kind of having discomfort of sorts, some pain. So give management for that, right? Apart from that, when you're actually giving management, think along the 3 lines. Number 1 is medical management, right? Supportive management, right? And any referrals if needed. Right. So when you're thinking along these 3 lines, you can actually, section your management itself and can have a clear idea from one section to another as you're going. Yeah, does that make sense? Yeah.
Yeah.
Order any appropriate blood investigations. This is basically to see if there are any other risk factors, that is impeding the healing. Is he having any current infection? Is he having any comorbidities that could be affecting the healing process itself? Yeah. Or for paracetamol, because he did mention there was a sort of a discomfort that he was feeling. Yeah, so you can actually give him for pain relief. Reinforce the importance of compression stockings in the healing, in the ulcer healing and long-term prevention. Discuss alternative compression like Velcro wraps or lighter stockings if current one is uncomfortable. Recommend adjunct treatment with pentoxifylline to improve circulation and support wound healing. So a lot of evidence has also been seen with pentoxifylline itself, that it actually improves, the ulcer healing, especially in early presentations. So that's actually backed by evidence. But then again, if you guys can't remember the medications, because it's not actually testing your knowledge, like I mentioned, if you don't know what to, what can be given, you can always get expert advice by referring the patient itself, right? So even when you're referring the patient, you can also mention that I'm going to be referring you to the specialist who, specializes in, vessels, and he can actually give you certain additional advice on any medications also that you can use to reduce the strain or improve the healing itself. Yeah. So that's also one way you can actually phrase it if you don't remember the medication. So it's fine. So this was unknown. Okay. Refer to tissue viability nurse for expert wound dressing and assessment of ulcer care. Arrange routine referral to the vascular team for potential surgical or advanced interventional assessment. Um, Advice on lifestyle modification, leg elevation, regular movement, weight loss if overweight, and avoid trauma to the affected leg. Yeah, see, those are all supportive advice that you can give. Advice against smoking, alcohol that can delay the healing process, right? Provide a leaflet about venous ulcer and compression stockings with tips on managing the symptoms at home. Safety netting, advise the patient to seek immediate help if they notice any signs of infection, arterial insufficiencies, or new ulceration, new increased pain, redness, swelling, pus, or fever. Schedule a nurse review in 2 days to ensure a better stocking fit and a GP follow-up in 2 weeks to assess healing. Interpersonal skill, use sensitive and empathetic language throughout the consultation. Whenever he says, I don't like the stockings, I'm so sorry that you're feeling this way, right? Is there something better that we can do for this? I don't want to use the stocking. Yeah, let's explore together, what we can do together. I can give you some suggestions, after I ask you a few questions and understand a little bit more about what's going on. Those are some supportive lines you can use. Address the patient's concern and expectations by providing clear explanation and reassurance. Ensure the patient understands the management plan and the importance of follow-up, offer continuous support, and encourage the patient to ask questions to express any further concerns. Address the patient's concerns directly, such as frustration with treatment or fear of worsening symptoms. Yes, invite questions and offer ongoing support, reassuring the patient that they are being monitored and supported throughout the treatment process. So yes, still some room for improvement for sure. But I think the second time over, it was a little more better. We should have actually gone through the list before itself. But I'm so sorry about that. I missed that in the first.
That's okay.
Yes, but good job, Dr. Niranga. Definitely, you see good improvement itself. But yes,
thank you very much. This is a great opportunity.
Yes, absolutely. But always think about the supportive treatment as well that you can give. I would say the second time over, you were able to get to management really fast, and that was good, right? You actually leveraged all the information that was, provided in the candidate info to actually make sure that you don't overshoot the questions that you're asking, because we all have a tendency to keep asking questions and like to understand deeper into what's going on. But the main thing is to understand how was the initial presentation, especially since this is a follow-up. How was the initial presentation? How is it worsened? I mean, how is it right now currently? Has it worsened? Is it the same? What is his current issues? Any risk factors if he has any, right? And then how it's affecting his life mainly. So that is the main thing that you need to gather in your data gathering, and then try to understand what all are the issues and how all you can manage it in different kinds of ways, like medical management, supportive management, lifestyle advice, right? Referral if needed. Yeah, awesome.
Okay.
So that was Dr. Niranga. Thank you so much, Dr. Niranga.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.